to such a level in West Africa that now is when you would start to. Kent Brantley said, a guy who knows something about this because he had it, he said this is a fire from hell, and if you think that the Atlantic Ocean is going to stop it from coming over here, you're kidding yourself.
Well, David, I don't want to disagree with Dr. Scarborough, but
no,
I have some.
All right, folks, that's from Meet the Press. We welcome you back, and we start the hour welcoming in Congressman Joe Pitts, Republican from Pennsylvania, member of the House Energy and Commerce Committee, and chair of the House Energy and Commerce Subcommittee on Health. Congressman, welcome, sir.
Thank you. Pleasure to be with you.
Well, thank you. The pleasure is all mine. I got to tell you, I've seen you talk about this. I read your piece about the facts about Ebola. Let me ask you. Do you have confidence in this administration, based on what you've seen and heard so far, that, I think in the words of the president yesterday, it's highly unlikely that we'll have an epidemic? That doesn't make me too comfortable.
Well, let's put it this way. I have confidence in what they are doing. I think they need to do a little bit more. I think they need to do a better job of communicating to our nurses and hospitals, intake workers on standard protocol. I think they need to be more aggressive in screening the people who want to come from West Africa in West Africa and screening them after they're here. So I think there's more than that we could do, but the administration has stepped up to the plate, and I think all hands are on deck now.
All right, let me ask you about the banning of flights. Lots of people have talked about that, the first thing that should have been done, for crying out loud, the FAA was quick to ban flights to Israel when they thought there was a remote threat of a rocket from Hamas hitting a plane, something that, never happened before, and Israel said was not going to happen. Nonetheless, it lasted for over 24 hours. But to the question of whether or not we should ban these flights from countries where there is an epidemic of Ebola from coming to the United States. Does that make sense?
Well, it makes some sense. I think they are talking about stepping up their observation, their testing, their screening of anybody who wants to get on the flight. And I think that has to be much more aggressive because some people will falsify in order to get to the United States because they feel if they get to the United States, they'll live. So I think they need to be more aggressive. I don't know if it should be completely banned, but there might be some time between when they apply to come, that there's some kind of a observation period in quarantine with much stricter surveillance.
Right, because even the gentleman who came back and apparently lied on his form in Liberia about contact with Ebola patients there, came back to Dallas. He, from what we hear, had no symptoms at the airport or on the plane. So that's not going to work foolproof. So maybe anybody who comes has to spend 21 days in quarantine and then come over, because that's what they say the incubation period is.
Yeah, that's exactly right. That could be done.
All right, well, okay, and with all due respect to you, and certainly I'm not here to badger you in any way, shape, or form, it just seems to me when you say that the administration has stepped up to the plate, that could be done. It's not being done. And that means today people could come over to New York, to your, God forbid, Pennsylvania, anywhere, and then start exhibiting symptoms. The CDC, the hospital mishandled that patient in Dallas. The CDC, I don't know, this woman was in that apartment, not isolated elsewhere, with her 2 children or 3 children for days, with the sheets and the towels that the infected person used. Then they sent some kind of, it looked like they went to the Yellow Pages and got some hazmat people to come in there and take care of it. She was complaining no one from CDC returned her calls or told her what to do. So just how have they stepped up to the plate?
Well, I was referring to the administration saying they're going to send 3,000 to 4,000 military types, not to West Africa, not to touch or treat the Ebola patients, but to help logistically to build clinics. Most of the clinics in some of these countries don't even have running water.
Right.
To build clinics, build small hospitals, teach and train a very strict protocol, like how to make the bleach, because if the crystals are still in it, it's not effective. how to incinerate the waste. There's 4 times as much waste from an Ebola patient as a normal patient, and to be an air bridge logistically to get this equipment, medicine, et cetera, from country to country because they can't do it now.
Right.
And that's what I was referring to.
Gotcha.
That's a pretty serious commitment as far as I'm concerned.
All right. Congressman, I appreciate you coming on. I'm sure we'll speak to you again. Thank you very much for your time, sir.
Yes, sir.
All right. Congressman Joe Pitts, ladies and gentlemen, Republican from Pennsylvania. We'll be back with the Malzberg panel. Don't go away.